Hello, everyone. Hello, and welcome to aidsmapCHAT. My name's Susan Cole,
And Matthew Hodson.
and we're so glad that you could join us for our weekly show where we'll be chatting to guests from around the world about issues around HIV, particularly during this current COVID crisis.
Yes, and we're live, as I will now demonstrate, I hope, by just sending the tweet, assuming it's there, because that's what we're being broadcast on. Yep, there it goes. And I have retweeted it now, just to prove that this is live.
Just
So
can't get you off Twitter at all, can we? Even during
well,
the show, Matthew. What's the deal with you?
no, that's it. I've closed Twitter down now. Now I'm just on this for
Go
bandwidth's
focus.
sake. Bandwidth's sake, I say that because, of course, there's always the terror of something going wrong. That's one of the challenges of doing these remote broadcasts online. Of course, nothing's gone wrong so far in the series, but who knows?
No.
We've got some amazing guests this week. I'm really excited that we have Dr. Oni Blackstock of the Bureau of HIV Prevention and Control for New York City. We've got Midnight Poonkasetwattana, who's the Executive Director of the Asia Pacific Coalition on Male Sexual Health, and he's talking to us live from Bangkok. So not only is his name Midnight, it is also midnight where he is. And we've got two brilliant young activists from the UK, Becky and Eli.
Wonderful. So, Matthew, I see on Twitter today that today is a special day for you. Would you like to share with our audience around the world?
Well, today is the 22nd anniversary of my HIV diagnosis, which obviously I was like incredibly young when that happened. I mean, like kind of 6 or something. I was 30 when I was diagnosed, and I do reflect sometimes that if I hadn't been diagnosed and if I hadn't been able to access treatment, I would not have lived as long as I have done. And I still feel fit and I feel healthy, and I'm really grateful that I was diagnosed in an era where treatment was available to me. But I think this is something which feels very live at the moment, because what I'm seeing, from friends and colleagues around the world, particularly with COVID and with the lockdowns that are happening, is that people are no longer able to access treatment, or some people, because of lockdown, they get unable to put food on their table, and without having food, they're unable to take their medication because they can't take their treatment on an empty stomach. So it's leading to real problems of adherence. Also, we're seeing problems with the supply chain. A lot of the drugs are manufactured in India, and because of lockdown restrictions, they're just not exporting, or they're not importing into some countries. So once again, I'm just made acutely aware of how this pandemic is having a huge impact on mortality, not just from the mortality that we're getting as a result of direct deaths as a result of COVID-19, but also people who are dying of other conditions who otherwise could have been fine, should have been fine.
Absolutely, yes. I'm really consciously aware of the health inequalities that we're experiencing at the moment. And there are, as you pointed out, there have been reports in Uganda of people just not being able to take their medication, not feeling able to, because they literally just don't have food to eat, to have with their medication. And it's such a challenge, particularly for people who live day to day and need to work on particular days in order to get the money to buy food. So the situation is very different from around the world. But I think that should be that's a good time to bring in our first guest from New York.
Hi.
Hi, Oni.
Thanks for having me on.
Oni, sorry. Just got it wrong again. I'm so bad.
No, you did such a great job. No, when you were introducing me. No, you did.
And then I got all smug and complacent, and it all went horribly wrong.
Yeah, so thanks so much for having me. And Matthew, what you were saying was really resonating with me, just in talking about what it was like in the early days when you were diagnosed, and just thinking about the folks right now in current day who are struggling to get access to treatment. At the New York City Health Department, that's something that's definitely a priority for us, making sure people have the medication they need.
Yeah, and of course, I mean, New York was one of the epicenters of certainly of the Western HIV crisis, and particularly amongst gay and bisexual and trans and queer communities there. How are those communities coping under lockdown? How are they coping with COVID right now?
So yes, I would say it's probably been like a varied response, probably a diverse response. So I think there are some LGBTQ New Yorkers who, again, experienced the early days of the HIV epidemic here in New York City, who may be experiencing a lot of anxiety and sort of seeing a lot of the parallels, some of what you mentioned between COVID-19 and the HIV epidemic, particularly around the government's delayed and maybe inadequate response in some levels to the pandemic, as well as some of the inequalities and the vulnerability that we see among certain populations. So we're seeing that, also seeing, social isolation. LGBTQ folks, especially older folks, are more likely to live alone. And so people really rely on their social networks. And so it's very different when you aren't able to see people in person, as you well know. Intimacy is really important, so lack of both social and sexual contact really impacts our overall well-being. And then also we've experienced the loss of a few LGBTQ community leaders to COVID-19. So Ed Shaw, who was like a longtime HIV activist, really known for his compassion and kindness. He passed away, as well as Lorena Borjas, who was a trans Latina advocate who saved many lives in the work that she did with trans women, particularly in Queens and throughout New York City. So I think it's really hitting folks really hard, but we're also seeing a lot of community-based organizations coming to really support folks and really work on connecting folks virtually.
Okay, wonderful. And
that is one of the connections we are seeing between the crisis in the 1980s and the crisis we're seeing now. And I think that community response is so powerful. And so, I mean, at this time of such incredible difficulty, it does give you hope to see people responding and working together as communities to support each other.
Totally. There's Sage Connect. Sage is like an organization for older LGBTQ people, and they have a program called Sage Connect where volunteers can sign up to give calls to older folks who are queer who may be dealing with social isolation. We've also seen the Ali Forney Center, which provides services to homeless queer youth. They have kept their doors open during this time, which is tremendous. And organizations like the LGBT Center in the Village are offering online groups and remote services as well during this time. So they have really stepped up to support the community.
Oni, Black people seem to be hardest hit by COVID-19, both in the UK and the US. Why do you think that is, and how do you think we can address that?
Yeah, I think it all boils down to structural racism. You can think of it on several different levels. So structural racism impacts the types of jobs people have access to. So I know we see this here, and I think likely where you are as well, we see Black and brown people are more likely to be the frontline workers in service industries. So they're more likely to be then exposed to COVID-19. We also know it's also about where and how people are living. So if you're living somewhere where you don't have the luxury to socially distance, people may be living in homes where there are multiple generations living together. And so that increases exposure. And then we see Black and brown folks throughout the world, but in the UK and here in the United States, having a higher prevalence of underlying conditions that put people at higher risk for severe illness due to COVID-19. And that's a result of potentially lack of access to care, but also the weathering effect that we see from chronic racism, that it's a stress on the body that causes sort of advanced and accelerated aging. And then lastly, I would say provider bias also plays a role. So, we have stories here where people have gone to multiple doctors asking for testing and they have not been able to get it. And we do know from a lot of different studies that biases kick in when people are working in really high stress situations. And so to think that there may be people who may be overlooked because a provider has a certain bias towards one type of patient compared to another. So all these things act together and really increase the impact it's having on Black and brown communities.
Absolutely. And women living with HIV are disproportionately affected. What are you doing in New York to address that?
Yeah, so we have a few different initiatives through the New York City Health Department. A few years back, we convened a women's advisory board. So we have representatives from many different community-based organizations throughout New York City who are focused on the health and wellness of women, HIV prevention and treatment. And so that women's advisory board helped us to put on what has now become an annual event, which is a Women's Health and Activism Summit, which brings women from all over the city, many different communities, to really talk about and advocate for issues around sexual health, mental health, intimate partner violence as they impact women, particularly Black women. We also launched in 2018 our PrEP for Women campaign. So that, PrEP is the once a day daily pill that you can take to prevent HIV. And so that was a campaign that blanketed the city, primarily focusing on Black and brown, cisgender and transgender women. And then this past year, in 2019, we conducted a campaign directly to women's healthcare providers to raise their awareness and their knowledge about prescribing PrEP to women, knowing that Black and brown women are disproportionately impacted. So that's some of the work that we're involved in.
I always think that the work that's coming out of New York, this status neutral approach to HIV prevention, to some of the campaigns you're doing. I mean, I always find, bloody Twitter, whatever, but I'm always retweeting the stuff that comes out of New York, because I just find it really inspirational, and I think the work you're doing is fantastic, and it's such a pleasure to have you on the show.
Thank you so much. Thank you.
Thank you so much for coming on, Oni. It's been an absolute delight.
Okay, be well and stay safe.
Thank you. Thanks again. Bye-bye.
Oh dear. She's amazing, isn't she?
Yes.
Well, we were talking earlier on about some of the challenges that we're hearing about in terms of getting access to treatment, and obviously this is a challenge worldwide, but it is affecting different countries in different ways. We've heard a lot coming out of Uganda and Kenya, and also in South Africa. And also I was reading today about Pakistan and about Indonesia. We've got a great guest now. We've got Midnight Poonkasetwattana. Oh, sorry, I'm so terrible with these names. I'm just going to get everyone's name wrong today. And he is speaking to us from Bangkok. Hi, Midnight.
Hi, Susan. Hi, Matthew. Hi. Good morning, should I say, or should be good evening?
Good morning to you.
What time is it actually there, midnight?
Well, it's coming to quarter past midnight now.
Yeah.
So Midnight, I was actually in Bangkok earlier on this year, and when I was there had been a couple of cases, and I mean at that point there hadn't been any cases in the UK at all, and there was a lot of people were wearing face masks on public transport everywhere I went, but there was no lockdown or anything like that. But actually, I was just looking at some of the data reports, and Thailand seems to have quite low numbers of COVID being reported. I mean, what do you think the reason for that is?
Oh, well, I think many reasons. I suppose in Thailand, or in Bangkok in particular, we've had quite a lot of pollution. So people are used to wearing masks, and then we've had political upheavals and flooding and SARS. So I think people are so used to wearing face masks and, staying out of the way. And I guess also that we don't touch people very much. So we greet each other, like a Y, like this, and not a lot of touching as well. So that I think helps in terms of the kind of social distancing that everyone's practicing at the moment. In Bangkok, the lockdown came in about mid-March, so about 18th of March. And that was when I think numbers was really high, not just in our region, but also in Europe as well. And I think that's when then we realized that there has to be much more stronger measures, particularly around. So now we have curfews from 10 p.m. to 4 in the morning, and the decree for state of emergency is been extended until the end of May.
Okay. I mean, just when you said the kind of culture is not about touching, and I would just say I went to a gay bar when I was in Bangkok, and I got touched, and I was like, oh, okay. But it is, I mean, Bangkok, especially in Thailand, is much more liberal towards LGBT than lots of other countries in the region. How do you think LGBT communities kind of across Asia and the Pacific region, how are they coping right now?
Well, so Matthew, you've been to the gay bars in Bangkok, so you would know that we really rely on the tourism industry, right? So as sex workers, it's really famous globally, and they're really suffering at the moment, particularly because there is no customers, and because of the lockdowns, and it's much more difficult. I was actually on kind of co-hosting a discussion with the LGBT community in Thailand this afternoon, and Swing, the sex worker community, has been talking about like how some have been able to kind of work on cyber sex online, but many are still relying on being in bars or being in certain hotspots, and then have the kind of like those customers. So with the lockdown and the curfews, it's been very difficult. So Swing has been given like food packages, sanitary pads, water, to the communities, really like at the core phase in terms of responding directly to the sex workers, whereas in the states or other big NGOs are not able to really reach the populations.
And Midnight, have you found that people are having issues in terms of getting hold of their ARVs in the regions that you work with?
Oh, definitely. So the organization that was co-hosting this call this afternoon, the Post Home Center, they work with people living with HIV, particularly for MSM and also trans people. So massive issues, even though some places, hospitals in Bangkok can send ARVs multi-months to the clients, but many said like they didn't disclose to their families or whoever they're living with. So getting packages from the hospital, can really out them basically. So for hospitals to kind of dispense multi-months, they would prefer to kind of have it, not issued in the hospital package, or actually they would prefer to go to community-based organizations to receive the packages somewhere else. So this is where I think the communities really plays a key role in terms of the being part of the health systems, where I guess all of us know that we've been talking about it all the time around communities being at at the center of the response. And this right now, actually we need to document how the communities can really mobilize themselves, even though with limited resources, to really reach the populations and be able to kind of like air out the concerns that their peers, friends are experiencing.
Yeah. It's interesting. I think that's another theme which I'm hearing about from all around the world is actually kind of how the attitudes towards sexuality, for example, is having a real impact, or the attitudes towards HIV is having a real impact. Because if people are unable to be open about their sexuality, or they're unable to be open about their HIV status, that creates more barriers. We're seeing horrendous stories about intimate partner violence, but also abuse of children within family relationships, because everyone's stuck at home. And so all of the challenges that are there existing anyway are exacerbated because of that very enclosed relationship that people are having right now.
Well, just to give an example, the T group, which works with LBQ women, also talked about being stuck at home with families that might not accept them, and there are cases where there is violence, where they want to reach out to be able to kind of move somewhere else, and the coordinating between different agencies to move people away from where they experience violence has been really difficult to coordinate during this time.
Midnight, it's been fantastic talking to you. Thank you so much for coming on the show, for staying up so late, and we wish you.
Thank you, Matthew. Thank you, Susan. Have a good
Thank
night,
you so
everyone.
much, Midnight. You can go to sleep now. Thank you. Bye bye.
Okay. Dear. I was just reading. Again, we think about some of the kind of other losses that we're experiencing as a result, and we talk about our ability to prevent HIV and looking at, or to treat it effectively. And I see that the Bill and Melinda Gates Foundation have recently announced that they're actually now going to push all of their funding into COVID work. And they have been one of the big funders of HIV work, including, treatment research, as well as lots of really supporting prevention activity around the world. And we're going to see the impact of this, and it's really quite frightening.
Absolutely, and that's one of the issues that our friends at GMP Plus have really been highlighting in terms of how the HIV response is going to be affected by this, because we've made so much progress over the last few years, and it's so worrying. If funding is taken away from HIV, what's going to happen?
Yeah.
So, yeah.
I'm going to do a really cheap segue, but I mean, one of our next guests, Becky Kroger, and the first time I met her, she talked about, being born and as a child, just, expecting to die because there wasn't the effective treatment. And then when you meet her, which I hope she'll be coming on any moment now. She has such exuberance and life. There she is. There she is. Hi, Becky.
Hi, and have we got your mate Eli with us? Hi.
Hi, bro.
Hi, guys. How wonderful to have you both on. I mean, the youth voice is so incredibly important. So it's an honor and a privilege to have you both on. I mean, we were just having a chat just before we went live about how young people are being affected, and I know there was going to be the Chiva camp in August that's been postponed, and you were very enigmatic about what's happening for young people living with HIV.
So at the moment, I'm in touch with the Children's HIV Association, Chiva, and we are basically virtually keeping in touch with young people within our network, and we're making sure that they're okay. And every Tuesday, I join a Zoom call with them, where we check in, we make sure that everybody's got what they need at this time, and we also check in help them set goals for what they're going to do in the future, maybe next week or the week after, and things like that. Really, it's been a bit crazy, but we're making sure that we trying to reach all of our young people from camp.
Brilliant.
and Eli, as a trans man, how is this affecting trans youth?
I think a major problem is probably transphobia at home, and sort of trans young people being stuck with either transphobic parents or other people in their houses, and they can't quite always have the opportunity to be themselves. And I'd reckon maybe also lack of being able to know what's actually going on in terms of access to care and being able to access hormones and blood tests and appointments, and especially with really long waiting lists, there's a lot of uncertainty on how people are actually going to get their appointments in the future.
Yeah. And I see, I mean, the government seems to be making kind of really unpleasant noises right now about treating trans teenagers.
I think Corona's definitely made a little bit of air, a bit of space for transphobia, especially within the government, to just sort of come around and the media not pick up on it so much because of all the other news on lockdown and stuff.
Yeah, I find it really quite extraordinary. I mean, again, I'm talking about Twitter again, but you go on there and I see trans communities being attacked at a time when we should all be looking out for each other. We should all be really trying to support each other. It just sickens me. So I'm really sorry that you and all of your fellows are going through this right now. It's really not the right time to attack anyone.
No, it really isn't.
So what are your strategies for actually sort of staying cheerful? I know the two of you are like busy mates, aren't you? So
they hate each other, really.
One of the first things you did was to speak to each other this morning.
Yes, so I have this thing where I just have to FaceTime my friends But I'm not that normal texter or like just contacting you over Snapchat. I will FaceTime you. So this morning I FaceTimed Eli just to check in on him, and then also just to talk through about what we're doing now, really.
Yeah.
Yeah.
And how about you, Eli? Is staying socially connected really important for you in terms of coping at the minute?
I think so. I think it's good to stay connected with like communities that I belong in. Otherwise, I am very isolated. Well, we're all isolated, but it can be, especially when you're living with HIV and you're trans, it's very like you have all these other things that you can't quite relate to the people in your house. So it's nice to stay connected with friends.
Wonderful.
Do you live with friends or with family, or?
I live with family, so there's lots of loud children running around.
and so what would you have a message for young people living with HIV today who may be struggling through this crisis? Is there something that you would like to say to them?
Me?
Yeah, okay, go for
it.
Becky
first. So basically, I did my message on the Chiva Twitter, but it's just basically to say that, like, as a person living with HIV myself, I really am thinking about other young people living with HIV in the country, and in fact all over the world that might be struggling. And my message is to you guys is, if you can be in contact with other people you know who are living with HIV, get in contact and have a catch up. And also most importantly, if you can and are comfortable, take your meds together, because I found that has helped me and a couple of my friends that I'm taking meds with at the moment.
That's great advice. And Eli, your words of wisdom to the nation.
I think to just stay connected, like keep in touch with friends, keep in touch with groups, and take your meds. Always take meds.
It's always a really important message. Thank you both so much for coming on the show. It was really
great
to see you.
Wonderful.
Wonderful
to have you.
All right. So since we've been on air, we just got a message. It was in response to me saying that it was my 22nd anniversary, and someone just kind of wrote in and said that actually his experience was he's only just been diagnosed, and because he was diagnosed late, he actually was diagnosed with pneumonia, was hospitalized, and then came out of hospital, and suddenly this everyone has now kind of got ill, or suddenly he came out in the midst of a pandemic, and how traumatizing that must have been, I guess, for anyone who has been isolated for another reason and then can come out and find that this is what's happened in the world. It's kind of quite intense, isn't it? I guess.
Absolutely. So your words of wisdom then, Matthew, let's put you on the spot for someone who has been diagnosed today.
My words of wisdom, it's always make sure that you're well informed, take your meds, and moisturize, because you're going to live for a long time.
Wonderful. And I think that we have now just run out of time. That half an hour has gone so quickly. I would like to say a huge thank you to all of our guests. You are all extraordinary. I'd like to say a big thank you to Disruptive Live for their technical wizardry. We didn't seem to have any technical fails this time, so it wasn't too traumatic, but it's been an absolutely brilliant session. And I'm very much looking forward to next week. Would you like to share who we've got coming up?
Next week we have Dr. Regeshri Dharawan, who is one of the leading lights in the HIV care world in the UK. Susan, have you ever heard the expression "U equals U"?
I have. Indeed,
right. Yes. Well, that's probably as a result of the advocacy of the incredible Bruce Richmond, who is the founder of the Prevention Access Campaign, or one of the founders of the Prevention Access Campaign, and who has made it his mission to ensure that everyone in the world knows that people who are virally suppressed on HIV treatment do not pose any risk of sexual transmission to their partners. And he is an amazing guy, and we're really excited to have him on. And Am I right that we've got Ian? Is Ian coming
We
on?
have indeed.
Okay.
Yes, we have.
And we also have my very good friend Ian Green, who is the chief executive of Terence Higgins Trust, the UK's largest HIV charity. And not only is he that in that esteemed role, but he has actually got a very personal perspective on COVID, because he came down with it himself and was quite poorly. Because of work, I have had lots of Zoom calls with him, and I have to say, Ian, I love you, but you look like hell. Not now. You look great again now, obviously, but it kind of really brings it home to you how this can strike down anyone. So it'd be really interesting to hear his perspective next week.
Wonderful. So thank you again, everyone, and we will see you next week at 6 p.m. UK time. You've been wonderful. Thank you. Bye-bye.
Bye.